I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Let's try to understand the process of IUI, Intrauterine Insemination. It can be broken down into a few parts. The first is egg making. Egg making involves giving you medications for an egg to grow, or maybe one or two in addition to what usually happens every month in a natural cycle. These medications could be tablets or injections depending upon the response that you give to these medications. Once the egg is grown, they are tracked, as in ultrasonography is performed. This is a very important step because we are wanting to get the control of the entire cycle under us so that we can decide when the IUI can be done at the right time. These ultrasonographies are not too many, so maybe 2 or 3 scans will be performed during this entire procedure. The medications will be given to you for about 5 to 7 days depending upon your response. Once the scans are done and it is decided that your eggs have grown to the right size, then the eggs are released. And that is, medications are given to make them release from the ovary. Once they are released, they come and wait in the fallopian tubes. At the same time, your partner's sperms are taken and sperm rinsing is performed. It is a sperm processing procedure where dead sperms, debris or seminal plasma, everything is removed from sperms. A neat bolus or a pellet of sperms are taken and transferred into your uterus. So when you are naturally trying to conceive, the sperms are deposited in the cervix, in the vagina, and they swim up. But in IUI, sperms are deposited in the uterus. So the distance for the sperms is reduced by half, and therefore chance of fertilization increases. Once that is done, about 14 days later or 2 weeks later, a pregnancy test is performed to see if you are pregnant. It's a fairly easy procedure which involve low dose medications, and there are not many side effects to this procedure. If you want to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.